Well, welcome to the conference. First of all, may I ask you what brings you here and to this specific conference and how important you think it is for Malta?
Yes, very important. In my position as Superintendent of Public Health for Malta, I'm very much interested in how we can put the patient more at the center of our health systems and looking throughout how digital technology can help us into achieving better health for our population. Something which is very important is that we still have a population who is not so tech savvy. So we need to see how we can help those patients so that we can ensure that whatever we'll be able to provide, it will be available to everyone. And this is the concept of health equity, which is something which we have been working all along the years. However, as these technologies come in, we need to be ensured that we will not be able to leave anyone behind because these people will not be so tech savvy as other people are.
That's a very important point. In fact, we were speaking to the Minister about that this morning. How important do you think is to, especially for the elderly, in getting them, say, to use this tech or to, I know you have the My Health
Yes.
websites and everything. In general, are they using these facilities?
So we're seeing things like you've mentioned, we've had My Health for quite some time now. And we're seeing a number of people who are getting on. And something which is very important is that many people, like, for example, grandparents, seek the support of younger ones. So we need to emphasize more on this intergenerational support. So we have our elder who can give us the experiences which will not be lost. However, we have the younger ones who can help the elderly come in terms with the new technology that we have today. And if they're not able to be so tech savvy, they can support them. So that will be very important so that we will ensure that everyone is on board because here we have a big opportunity that we cannot lose. We know, I am a doctor. Sometimes you find yourself doing things which my mind says, oh, a computer, a software system could have done this for me and I could dedicate more of my time with the patients. So that is what all healthcare professionals are asking for. The patients are calling for us to give them more information so that they can look at their mobile and find the information rather than wait for the time to have the information available. I remember my time when I became a doctor, we used to go to the X-ray department and make friends with the people there so that they will find the X-rays, the big chance heavy ones, available for us to be able to manage the patient. Today you can open your PC, you log in and you can see the X-ray of your patient. So we've moved there, but now the technology is running fast. So we need to make sure that we apply whatever tools we have available for us for the benefit of our patients.
And you've been in the medical sector for some time and seen many, many changes. Incredible work, of course, during COVID-19 and I think Malta was definitely at the forefront in dealing with this situation. From your own point of view, when you see conferences like this, why do you think they're important for Malta?
It's very important because we have had experiences from abroad and I believe that we need to learn from good practices. There are innovations which have worked and others which have not worked. So if anything has not worked in other countries, let us evaluate and see why it hasn't worked so that we will be able to learn from those experiences. There have been failures, but we need not just chuck them out, but learn from it. What has been done not so correctly so that we will be able to develop something which is very important. It's important to have these conferences because there's networking with other people and also learning from each other.
And tell me, going forward, what plans do you have for yourself and your own role going forward in coming into 2023?
We need to get people closer to being concerned about their own health. So giving the people the control over their own health, giving the people the control for the information that we have as health authorities about them is very important because once you have that information about yourself, then you are in a position to take an informed decision to control your own health yourself. So let's put control more at the patient's end, and we are there as the health authorities and healthcare workers to lead them the way and support them.
Well, thank you very much, and we hope you enjoy the rest of the conference. Thank you.
Very much.